Hey, Dr. K.
Hey, Dr. K.
All right, what are we talking about today?
Hospice and palliative care.
So, what is hospice? What is palliative care? We're going to touch on both and hopefully get some clarification. So, let's start with hospice. I think we are a little bit more familiar with hospice, but tell us exactly what that is.
Yeah, so hospice is on the continuum of end-of-life care. It starts when a patient is facing a condition for which they are not going to be able to recover from. And hospice involves specialized nurses and caretakers to deliver that care, most of the time in the home, but sometimes in a hospital setting or in a respite facility.
So those are called like hospice houses, right?
Yes, and They are somewhat limited depending on your community, and for people with differing cultural beliefs or philosophies may choose not to die at home and may want to have access to a hospice house.
And something about 6 months, right?
The technical definition is that hospice care starts when expected life span is less than 6 months. I think a common question about hospice care is, what does that mean at home? And hospice care is not round-the-clock care.
Mm-hmm.
So the majority of hospice care at home is delivered by family members or loved ones.
Okay, so let's talk palliative care. So what is palliative care?
So palliative care is the care we give to any patient with a life-limiting condition. That may be cancer related, it could be AIDS or COPD or heart failure. So it's not unique to cancer care, but it is different from hospice in that we are often still administering treatments to help prolong a patient's life. So for example, in cancer care, we may deliver palliative care at the same time as we're giving chemotherapy or radiation treatment.
So you'll still be getting your treatment, you're still seeing your doctor. Who's giving you the palliative care?
So it depends on the setting where you are treated. Some medical practices have access to a palliative care physician. Those practices are in the minority. So in cancer care, typically the palliative care is administered by the oncologist, and palliation as a term means treating the symptoms related to that condition.
It's like nausea, vomiting,
breathing problems,
pain,
mouth ulcers.
Okay. And sometimes that's called supportive care, is that right?
Yes. So supportive care is oftentimes synonymous with palliative care.
I think people think hospice and then they hear palliative. I think they think palliative is end of life, and I think it just gets really jumbled for so many patients and families. So I think clarifying that and giving that guidance is a big deal.
Discussing end of life wishes is part of palliative care, but I think the important difference is that we're still administering treatments that are intended to extend a patient's life.
Yeah, I think some people understand that aspect of hospice care, that we're not really treating much at that point, correct?
At that point, the situation is such that those treatments may have more risk than benefit to a patient.
Okay.
And the focus becomes on helping a person feel as comfortable as we can.
Sometimes called comfort care, is that what it's
Correct.
called? Okay.
Yes.
There's so many questions there, and I'm sure, a lot of your oncology visits are filled with these types of questions. So check us out at AskTheMD.etsy.com. You can see all of our physician-created question guides from the Ask the MD physician team. These are questions that are intended to help make your medical visit easier and make the most out of your medical visit with your medical team. So check us out at AskTheMD.etsy.com. See ya.
Thanks for stopping by.
Bye.